Microphlebectomy is a very effective method of treatment. It's a more traditional treatment, but it has very good patient satisfaction levels and gives very good end results. Typically, the treatment involves a one-time treatment where you get either put under anesthesia to have it performed, or we administer Valium and perform Novocaine anesthetic in the office if you prefer not to be put under anesthesia. Typically, there's only one required follow-up afterwards, which is about 10 to 14 days after the treatment, just to verify that everything's healing properly and that the patient's satisfied with the end result. But it doesn't require multiple follow-ups. It just is a one-time follow-up with me afterwards. Certain patients, unfortunately, are not candidates for some of these less invasive treatment options that we offer at Austin Vein Specialists, namely laser therapy, radiofrequency therapy, Varithena, Venaseal. Those are really popular because of their extremely minimally invasive nature, meaning no incisions at all. We do that all through the IV. The issue is that some patients, unfortunately, are not a candidate for those less invasive therapies. Usually the reason for that is that they have extremely large veins. So patients sometimes will let their veins go for too many years, and the veins just keep growing and growing and growing, and before they know it, they have very large ropey veins on their legs that are numerous. A lot of times with those huge veins, they've missed the window for minimally invasive options. The veins have just gotten too large. In those particular patients, we'd like to offer them something to actually cure their problem and get rid of their disease. It goes more to a older, more traditional therapy, which is referred to as microphlebectomy. Some patients refer to it as just phlebectomy or stab phlebectomy, but in our practice we refer to it as microphlebectomy, mainly because we use very small micro incisions to remove the larger veins. So when you treat a patient with microphlebectomy, the goal is to shrink the veins down as small as possible before you try to remove them. That way you can make very small incisions in the skin to remove the actual veins themselves. The way that we do that is we numb up the leg veins and shrink them in a process called tumescent anesthesia. Tumescent anesthesia essentially involves using a very small acupuncture-sized needle to infiltrate a special chemical around the veins to cause them to not only spasm down but also to become completely numb. It numbs not only the veins but also the skin. After the veins have shrunk and the area is completely numb, then we make a small little incision in the skin in order to run an instrument beneath the surface of the skin that grasps the vein and physically removes it. It is definitely a more invasive treatment than other treatments that we offer, but patients that have vein disease that's already severe and they're looking for the least invasive method of taking care of those larger veins, microphlebectomy is really the best option out there. In my experience as a vein specialist, having done this for about 15 years now, is that almost all patients that we see are candidates for some sort of minimally invasive therapy, meaning non-surgical therapy. It roughly is, I think, 10% or less of our patient population that end up with some form of microsurgery or plastic surgery to treat the entire condition. But I would say over 90% or close to 90% of our patients are able to be treated with the minimally invasive options, non-surgical options. In order for a patient to be able to determine whether they're a candidate for these less invasive treatment options versus if they need something more invasive such as a microphlebectomy surgery, the only real true way to determine that is to see a vein specialist and get evaluated. There's never really a definite cutoff point where you're not a candidate for this or you're not a candidate for that just by looking at someone's legs. The reason is there's a lot of times something going on beneath the surface that is not obvious to me or the patient just by looking at their legs. They really need a thorough workup with an ultrasound to really see what's going on underneath the surface before you can really tell them what their options are. The reason for that is a lot of times you can make larger veins at the surface shrink down dramatically just by treating an underlying vein with a less invasive method. So a patient that may think, oh, my veins are too big, I have to have surgery to get this taken care of, a lot of times that's not the truth, or that's not, factual. Because a lot of times we see on ultrasound that really the only reason those veins are that large is because there's a bigger vein beneath the surface. Although microphlebectomy is a more invasive option, meaning it does require some small incisions, it definitely is a good option for a lot of patients with larger varicose veins. The issue with microphlebectomy is that even though it is more invasive, you can actually get an extremely good cosmetic result with the treatment. So even though we do have to make some small incisions, after you heal, the scars are extremely small and a lot of times very hard for anybody to even see or notice. So there's typically a dramatic change from having large ropey veins on your leg to suddenly no bulging veins, and some tiny scars that are hard to see. So it definitely is a great procedure in terms of getting a great cosmetic result. One of the other advantages of microphlebectomy over other vein treatments is that there's that instant gratification of going into the treatment with very bad looking legs and very large symptomatic veins, and coming out of the treatment a few hours later with no veins and no symptoms. So you have that immediate gratification of the veins being gone. There definitely is a short recovery period after that of having to, get over the inflammation and swelling of the leg, but in general the satisfaction level after microphlebectomy is extremely high.